Hi, everybody. I'm so sorry for the technical difficulties. It seems that our normal server that we've been using to broadcast these videos was having difficulty bringing Facebook into the feed. So I apologize. I know I'm a few minutes late. For those of you who are on YouTube, thank you for waiting. Hopefully, we're good to go now, and we can figure out our issue with the broadcast studio. We can figure that out for next week. So welcome back, everybody. Again, for those of you who haven't joined us before, my name is Elizabeth, and I'm one of the travel team nurses here at CNY Fertility Center. And tonight, the topic of our conversation is going to be your partner's role in this process. So I got the inspiration for tonight's topic from a very close friend of mine who sort of told me the story of how when she and her husband were going through infertility treatments, she was always the primary focus of all discussions, of all, basically of everything, even leading up until the time that they had their son and he spent some time in the NICU, and everything was once again focused on her, which again, not a bad thing. But I think it's important. We go through these, many of us, not all of us, some of us, some people are single moms by choice. There are all kinds of different circumstances and scenarios. And so if I don't mention your specific scenario, please don't hold it against me. But ultimately, I wanted to talk tonight just about your partner's role in the process. We will be talking more specifically about the male partner's role. Obviously, we have female couples and things like that, but we'll talk mainly about your partner's role in the fertility process. And we're going to start with talking about sort of the different causes and problems that can come up with male infertility. For those of you ladies here, you know, many times the blame and the fingers are getting pointed at us as the underlying reason behind the infertility. But it's estimated that up to about 50% of all cases of infertility have some a component of that is in fact male infertility. And so male infertility can be caused by a lot of different things. And we'll talk briefly about some of those things that can cause male infertility. Then we'll talk about male testing and some things that males can do to improve fertility. We're going to talk about sperm and some options for getting your partner's sperm to us or getting donor sperm to us. And then toward the end, we'll talk more about just sort of how we can include our partner in the process to make sure that, unlike my friend from the story that I told a little bit earlier, who just kind of felt like left out and not really as included as he wanted to be, we'll talk about ways we can include our partners in the process. Okay. So again, for those of you just joining us, I do apologize. I'm a little bit late. We had some broadcast difficulties, but I'm here now. And so we'll talk about what we just kind of lined out, and then we'll address some of your questions towards the end. I know that's a really popular reason to engage in these videos. So I don't want to leave that part out. Okay. Hi from San Diego. Hi, Claudine. Hope you're doing well. So, okay. So some of the things that can lead to male infertility, we can see just some very basic sperm issues. Sperm have to swim. Sperm have to be of a reasonable shape to be able to physically penetrate the egg. And then we've got to have enough sperm for those sperm to actually do what they need to do. Jessica says, my husband feels very left out, not even being allowed in the clinic through this process. Well, Jessica, I'm not sure if you're talking specifically about our clinic, but your husband is always welcome with you in the office, pending he has a mask on. That's really our only requirement. So your husband should definitely not be feeling left out like that. So sperm issues. So like I said, sperm have to swim. There have to be a good number of them, and they have to be of a shape that can penetrate the egg. And if any one of those things is off, that can negatively affect your fertility, whether that is just trying naturally, IUI, IVF, it can certainly affect the process. The first step for all males who are involved in this process should always be a semen analysis. We often, as I mentioned, we assume that it's the female who is the, maybe the culprit or is to blame. I think it's worth noting that no one is to blame. Infertility is something that affects, everyone equally. And so nobody is really to blame. We all, like I said, we all have a role, and we just need to address our specific role. But that first step really should be knowing all the information. And so that starts with a semen analysis. Most local LabCorp offices, a lot of local labs, a hospital, outpatient hospital lab, oftentimes you can get a semen analysis done there. Like I mentioned, a lot of labs offer it. And then of course, if you are near a local fertility clinic, they certainly would potentially be able to perform that analysis. A couple of people are asking about male supplements, and I'll get to this a little bit later, but there are a lot of different things that our male patients can take in order to improve their overall parameters. So we'll get to that a little bit later. So we talked about sperm issues, and one of the best ways that identifying those, some more basic issues, would be a semen analysis. And then pending the results of that, then we can kind of make a determination based on, is it normal? Okay, then we need to do this, versus what aspects of the analysis might be off. So we mentioned sperm have to swim. There have to be a good number of them, and they have to be a good shape. And so that semen analysis is going to come back, and it's going to tell us what those parameters are. And if anything is off, then we can sort of tailor specific treatments or supplements to what parameter might be off. And so other things that can cause male infertility, there are congenital or birth-related issues that can lead to male infertility. Things like absence of the tubing, sort of, if you will, that leads the sperm outward out of the body. So there's different congenital things. There are chromosome issues that can contribute to infertility. There can be fragmented sperm that can create a situation where we're not making good quality embryos. And so that could potentially be an issue. Structural issues. Males can have issues where they have swollen veins. They can have undescended testicles, defects in that tubing I kind of mentioned that leads the sperm out of the body. There can be defects in that. And so that can be a situation. But we can't know, and we can't really properly investigate if we don't first get that semen analysis and determine what we're dealing with. And so if you hear nothing else from this video, get a semen analysis if you have a male partner and there's still questions about what might be going on. The semen analysis is truly an important piece of the puzzle. So in addition to sperm issues, congenital issues, chromosome issues, and structural issues, hormone issues can be having a role in the process as well. So some simple blood testing. If we get a semen analysis and we see some abnormalities, or maybe we don't, maybe we want to just take a look at some basic lab work to make sure that everything is as it should be. Nefertiti is saying Conception XR for male vitamins is amazing, and it truly is. That's a supplement available from a company called Theralogics, and that's a great supplement. We've also established, or we've rolled out a supplement through our molecular fertility line called Male Central, and that is another fantastic supplement to help improve those three basic parameters, which are how the sperm move, how many there are, shape. There are supplements that can help improve morphology as well. But that's, thank you very much for throwing that suggestion out. So in addition to those other issues we mentioned, we can see issues, ejaculatory issues, where there's low volume or there's just trouble ejaculating in general. men can actually have retrograde ejaculation, where the sperm kind of goes backwards and it ends up in the bladder. And that can be a reason for a low sperm count in the actual ejaculate if the sperm is going, sort of like I said, backwards into the bladder. Infection, immune issues, medications, some very simple medications like arthritis medications and blood pressure medications can absolutely be the cause of some infertility. You can absolutely go to a regular urologist for treatment or for testing, Ashley. So that's a great point too that I didn't mention at the beginning. There is that in addition to some of those other places that I mentioned, you can absolutely call local urologist office and see what resources they might have even for a semen analysis. So medications, like I was talking about, simple arthritis medications can be enough. Hi, Jackie. Can be enough to affect the sperm counts. And so just looking at those overall to determine, is there anything? Yes, Liz, I'll absolutely be going through supplements and things we can do for our males. Specific to morphology, definitely check out that Essential Male line. I do believe that has a component to it that can improve morphology. So take a look at that. But disease processes, things like celiac disease. If your male partner suffers from celiac disease, that could have a potential role in semen issues or sperm issues. And so the point is, and the last thing that is really oftentimes a big contributor to male sperm issues is environmental or lifestyle issues. Hi, Julia. Hi, Mimi. So yeah, things like chemicals, heavy metals, radiation, biking, doing time in the hot tub too often. These are all simple things that I think sometimes, again, we overlook. We oftentimes pigeonhole female patients as looking constantly at them and their role in the infertility spectrum. But some very simple things can very much be the reason for some difficulties that we might have. And so with all of that said, male testing, we touched on it briefly, but male testing beyond just a semen analysis, if that's good to go, then we're good. Let's move on. But if there are any anomalies or parameters in the semen analysis that aren't quite where we'd like them, we can look at doing some hormone testing to get a sense of maybe what might be underlying those issues. And so blood testing, we talked about simple blood testing hormones to see what role those might be playing. There is testing, I believe I mentioned a little bit earlier, but if we are not finding anything obvious, we can take a look at whether or not the sperm themselves have DNA fragmentation. And there's a specific test that we can do to check for that. We can also, something that's not specifically related to sperm, but that is tightly linked to male infertility is chromosome issues. We mentioned those earlier, but the testing that you would do to see if that is a component would be to do karyotyping, which is a blood test that essentially gives us a look at your chromosomes to see if they are in the correct number, pattern, shape, size, those things. And so if something is off with that, that can very often be we can unlock a piece of the picture. And then as somebody mentioned earlier, and we talked about briefly, consulting with a urologist. So if sperm parameters are not where we want them to be, a urologist can be a great source of information and help in guiding us in what might be going on from the male perspective. Okay. One thing I wanted to talk about, somebody asked it earlier, it might be a crazy question, but can you freeze your partner's sperm? Yes, you can. And we recognize that not only does traveling to us from wherever you might be coming from add a whole element of sort of stress and frustration sometimes to the process, but sometimes just the what might seem like a simple act of getting the sperm here can be really tough, especially if you're traveling from afar, if your partner works out of state or overseas or is in the military. There's a whole number of different reasons that that you may have difficulty aligning your schedule with your partner's in order for him to be available at the retrieval. And so there are some options. While we always say fresh sperm is best, ultimately our office here at CMY Fertility, we use sperm injection for all of our eggs, unless that's something that you decline to have done. That is something we do with all of our the eggs that we retrieve. Sorry, YouTube, I realize I'm looking up at Facebook quite a bit, so I'm trying to look back and forth between the two of you. So, yes, so things your partner can do. Oh, we talked about, we wanted to talk a little bit about getting the sperm to the office. So while we do say that fresh is best, because we individually inject one sperm into each egg, that helps in the sense that we don't necessarily need that count to be as high as otherwise we maybe did. Or even the shape of the sperm, because those things are important components to the sperm being able to physically get inside the egg. But if we're doing that, if we're taking over that process, that can help overcome a lot of male infertility factors like poor morphology or poor count. With all of that said, a lot of our clients really do need to have a frozen sample for various different reasons. And so what are your options for getting a frozen sample to our office? So first would be come to the office, provide and freeze a sample. And that would be probably the safest, most direct way. But if you're having trouble getting here for the retrieval, then you might be having trouble to get here at all. And so we realize that that's not necessarily a practical option. With that said, if you are somebody who is doing more than one retrieval, so some of our clients will do duo stim or back-to-back retrievals where they come, they do one retrieval, and then they go right into the next retrieval. And so in those cases, having your partner leave a sample at the first retrieval while you're here to have that then frozen for the next retrieval can be a good option if he is in fact here. But we do have an option for an at-home collection kit. Again, fresh sperm is always best. But knowing what we do know about injecting sperm, we know we can use frozen sperm. And so if your partner has, and I know we started out talking about male infertility, but if your partner does have a completely normal semen analysis, another big plug or a reason for him to get that semen analysis, or SA, as you'll sometimes see it written, is because if that is normal and you run into a snag, maybe he was planning to come with you, to travel with you, and now he can't, then if we have a semen analysis and we know that those travel plans change before, early enough in the process, before you were starting stimulation, sometimes we can arrange for that kit to be sent to you so that you guys can, he can collect it home, have it shipped directly to us, and then we can freeze that for your retrieval when you arrive. So we talked about coming directly to the office to freeze. We talked about the at-home collection kit, which is, again, only reserved for our clients whose male partners have a normal analysis, and then also for it would have to be in the office prior to you starting your stimulation, or whoever's doing the stimulation prior to them starting, just because we can't arrange for it on the fly type of thing. So donor sperm we talk about sometimes. If male infertility is a big factor, having a donor sperm backup in the office, and or having donor sperm in general is important. We've talked about this before on my videos, but just make sure that if you are using donor sperm, make sure that that is in the office prior to, again, starting medications, because we don't want to be trying to figure out the sperm issues at the end, at the end of things. We don't want to be scrambling. We want to make sure we know exactly how that's going to work out from the beginning. And part of that includes just making sure that the sperm is in the lab prior to starting medications. when providing a fresh collection, should abstinence be observed for any amount of time before the collection, Timothy? That's a great question. If you typically have normal parameters, there isn't a lot of evidence for abstaining prior to collection, because we know that you really, again, because we're doing sperm injection, so individually selecting and injecting a sperm into each individual egg, we truly really need the number of sperm that there are eggs. And so all the evidence points to that's not really an issue when it comes to if you have normal parameters. But there is a rule of thumb that you can abstain for between 2 and 5 days prior to that collection date. And that can sometimes improve the overall parameters. So if you've had a semen analysis, came back normal, there's really not a lot of need to have that abstinence period. But if there are questions, if you're concerned, 2 to 5 days is sort of the accepted standard for what would provide the most high quality sample. So I hope that helps. Nefertiti, that's a great question. Does the kit have to be shipped on ice? I don't believe so, but to be honest, I'm not very sure on the specifics of the at-home collection kit, other than just knowing that you do need a normal semen analysis, and we do have to have that kit shipped back and in hand prior to starting. But if you have questions specifically, if your partner has a normal semen analysis and you think there's some reason he may not be able to make it to retrieval, reach out to our andrology team and just ask them what those the specifics are, and they can kind of help explain that to you. So we talked about you can do the at-home kit. If everything is normal, you can freeze at the clinic. You can, if donor sperm is on the table, that's obviously you could have that come to the office. You can also freeze locally. So that's another really good option, especially for if you, let's say your partner is not able to make it to the retrieval and you want to freeze, but his sample isn't really normal. There is the option, and in that it's something you'd have to check with your local clinic and just sort of cross-reference that with our requirements. But he can freeze at a local fertility clinic and have that frozen sample shipped to us. So because I'm not super sure on the specifics of how the at-home kit works, but we do know that there's quite a bit of loss in the shipment process. With that said, I don't believe it is you ship it on ice, but again, definitely double check with andrology. But having it frozen at a fertility center and then having it shipped helps prevent that big loss of sperm while it travels to us. And so having it frozen in your local clinic and having it sent right away really helps make a difference. A couple questions I think are important right now. Does CNY in Atlanta freeze samples? As far as I know, I want to say that they do. I apologize, Nefertiti. I am kind of striking out with your questions, but I do believe that they do freeze samples. Double check. You can send a message to the andrology team on that as well, just to make sure. But I want to say that they do. You would be able to freeze samples. And then somebody asked, does the volume matter less with the direct injection process? It does. It does, because in the sense that we really need just the number of sperm as there are eggs, we can really overcome volume issues in that manner. Okay, I think I got to all the questions thus far. Sorry, YouTube, I just put my head up in front of you. But okay, so we can have you freeze locally. And there's also something I've learned recently about from a client of ours that used a company called Daddy Kit. That offers an at-home collection type of deal where they'll send you a kit, you can collect at home and then ship it to them. They will freeze it. They will analyze it. So they will give you the analysis information, and then they will freeze it for you and ship it directly to our office. And so that's another option as well. And that's called Daddy Kit. It's spelled DADIKIT. So that's another potential option in terms of getting the sperm to us. So that's kind of all of the nitty gritty. Some things we can do to include our partner in the process that I just wanted to kind of touch on. Sit down and go through your treatment plan with your partner. Talk about what the process is going to entail. Talk about what the medications look like, and if you're going to need his or her help. Again, we're talking about all partners here. And so if you're going to need your partner's help with the medications, sometimes putting if your partner's really looking for a way to get involved in the process or feel involved in the process, make your partner your medication manager. Have him or her set up, look through all the meds, cross-reference it against the receipt from the pharmacy and your list in your patient portal to make sure that all of the medications that were ordered are in fact in your possession, and have him or her set that up for you. Set alarms on both of your phones or your phone on for when each of the medications are due. There's a lot of different ways that your partner may want to be involved. And so just keeping an open line of communication in terms of what the process is going to entail. Emily says her husband was involved with PIO shots for sure. Absolutely. You, Emily, you and everyone else, you're very lucky if you have a male partner who is willing to do your progesterone shots. Not trying to throw mine under the bus here, but that was something he could not get on board with. And sort of to lighten the mood of male infertility issues, I always joke with clients that my husband's, the first time he ever met some of my coworkers was when he came to the office to collect a sample. So if that's not awkward, I don't know what is. But yes, absolutely, getting your husband or your partner involved in the medications, the administration of the medication. So having him or her give you the injections, whether it's the belly injections of the stimulation or the progesterone injections that are a lot harder to give yourself. That's definitely a great way to involve your partner. Some other ideas that I like to talk about is again, a lot or most of the support and things are geared towards the female. And so just sitting down and asking your partner, what is he afraid of during the process? What are his expectations? What does he think is going to happen? Those are all important. In preparing for this talk, I was doing some research on male infertility, and there's not a lot out there in terms of support for males who are involved in infertility treatment. There's not a lot of support. And so just getting there with your partner where you can say, look, what are you afraid of? What are you nervous about? And then recognizing that a lot of times, at least in terms of our male partners, they're not going to be quick to talk about their feelings. They're going to be much quicker to want to do things that sort of get us from point A to point B. And so just having that open conversation with your partner to see how you can support him or her. Again, talking about all partners here. But if it is male infertility, just seeing how you can support him, because it's not easy for him either. And as I always say on these live videos, none of us ever thought growing up, male or female, when we grow up and we want to have a baby, we're going to go to a fertility clinic and we're going to leave our sample there and we're going to talk to people about our sperm and our sex life. Nobody really talks about that because it's not really, it's not really well accepted in terms of open conversation. But recognizing that we all have a role in this, and how can we individually support each other through it is really important. And absolutely. So Timothy says, and thank you so much. You are going to be my consultant here, Timothy. But he says, being involved with the shots medication is a great way. We also have daily devotionals together with discussing, help us to start good conversation. So yeah, just being open and honest and discussing how the process makes you feel, what you're nervous about. Ultimately, those things matter a lot. Brandy, real quick, yes, chorionic gonadotropin 10,000 units USP is a suitable substitute for Pregnol. Yes, absolutely. Very, very, very suitable substitute. They both function the same way. Okay. on the topic again of supporting each other, I think it's really important not to assign blame. And I mentioned this a little earlier, but not to assign blame to either partner. Again, you are in this as a couple. As I talked about at the top of the show, a good friend of mine kind of mentioned that, he always felt like the challenges of the process were always spoken of as the female's challenges, and instead of the couple's challenge. And so this is a challenge to you as a couple. Infertility very well might be the hardest thing that you guys are going through together, and may ever go through. And so I'm recognizing that any difficulties that happen are your difficulties as a couple. Don't forget that you are doing this as a couple. And so the things that you feel, share with your partner. He might feel them too, and vice versa, male partners or female partners to female partners. Share what you're feeling. You guys are a couple first and foremost. And that really shouldn't be lost in the process, because oftentimes when it is lost, the relationship suffers. And we want to get you guys together as a couple through this hard journey. And so acknowledge that stress, talk about it, work through it, and see how you can support each other. The male partner may not want to talk about it, and the female might, vice versa. But ultimately, we want to be open so that we can, again, sort of weather the journey together. One thing that I've seen some couples do that's worked out really well is join a fertility support group for couples. There aren't a ton out there, but there are some Facebook groups and things like that. Always give my caution, be careful what you read on Facebook, because it's not all medically sound advice. But there are a lot of ways that you can get support through the process. And then again, last thing on this sort of how we can support each other, date each other, take each other on a date, make it, plan a surprise for him, or if you're a hims, plan a surprise for her. But again, looking at ways we can support each other and not forget that at the end of the day, you two are still a couple, no matter what the outcome of any cycle might be. So that's kind of everything for tonight's topic. I'll spend about 10 minutes answering questions, and then we'll leave it there. My friend Timothy here just says he's doing all the vitamins, chiropractic care, acupuncture, CBD, other anti-inflammatory. So you bring up a really great point. Acupuncture, traditional Chinese medicine is effective for male infertility. So that's an option, looking at acupuncture, chiropractic, those types of things. But looking at anti-inflammatory, I joke all the time that people must get sick of hearing me talk about inflammation. But it is in fact such an important piece of the overall puzzle of many of our health concerns, but fertility specifically. And so looking at anti-inflammatories like CBD can make a positive difference in male infertility. Other questions, again, YouTube, I'm sorry, I keep putting my hand up in front of you. Other questions, I'll scroll back a little bit. How do we get a kit for the at-home freezing of the sperm? You would want to reach out, pending that your partner does in fact have a normal semen analysis. You'd want to reach out through the patient portal to our andrology team. As long as that semen analysis is on file, they can kind of help link you up with the financial team to get that kit paid for and shipped out. So that's kind of how you would look for that. Does CNY do testicular biopsy? Yes, Jessica. You can, your male partner can have a testicular biopsy or a sperm extraction procedure, a sperm aspiration procedure. We do have a urologist that does those procedures primarily in our Syracuse office. So if that is something that you may need, definitely touch base with us now on that, so we can make sure that we have our urologist involved and make sure that that's on the radar, that your partner might need a procedure for sperm. And so that would testicular biopsies, procedures to extract sperm, those are options for if sperm parameters are an issue, if collection, if we don't find many in the ejaculate, oftentimes we can find some if we do testicular biopsy and that type of thing. So excellent question. Other questions? Well, great question from Christina. And I saw this earlier and I wanted to make sure I addressed it. Does smoking cigarettes affect sperm or the IVF process? And the answer is absolutely yes. Sperm absolutely is affected by cigarette smoking, by recreational drug use. And so if that is a factor in your case, I would absolutely recommend quitting smoking as soon as possible, because that that can definitely affect sperm and their quality, as can alcohol consumption can have a negative effect, and then the recreational drugs we talked about. So that's something that we highly recommend: stopping smoking, stopping recreational drug use, and that type of thing. Ashley is asking, we have an initial consult on February 26th, and we know we have an abnormal SA or semen analysis. Anything we can do in the meantime? That's a great question. And I would highly recommend, Ashley, that you take a look at a male fertility supplement. As I mentioned before, we offer one through our molecular fertility line called Male Essential. And that is a fantastic supplement. There are other ones on the market that you can look into, but looking at a diet, making sure that he's taking or he's looking at the high inflammatory foods in his diet, adding CBD where appropriate is a great thing to do in the meantime. And then if any of those lifestyle things we talked about, like riding a bike, hot tubs, things like that, if those things are at play, kind of removing those from the equation now can certainly make a difference moving forward. Timothy, thank you for your help, and you brought up some really great topics. Timothy says, thank you for having this discussion about partner involvement. The process being involved is important for me physically and mentally, but also helpful for my wife. She can't be on the video tonight, so I am. It takes effort, but it's worth it for both me and my wife. You are most welcome, and it's so great to see how involved you are, and see your perspective on how important you being involved is in the process. So thank you for sharing that. I really appreciate it. Is there a chart or resource on the website that shows exactly where to do the PIO injections? Lainey, that is a great question. If you go to our website, there is a section, I believe, top right, I believe it says education or resources, something like that. Maybe it says medications, but there are videos on the website that will show you exactly where to inject that progesterone and oil. It's the upper outer quadrant of your backside. And it is very important to make sure that we're putting it in the correct spot. I told someone, this is funny that you asked that, because I told someone this earlier today. Not only is it important to make sure it's in the right spot so that it is absorbed correctly, but it's also good. It's important to make sure it's in the right spot so that you can avoid some potential side effects. So if it's a little too high or a little too low, oftentimes you'll bruise worse, you can hit nerves, things like that. So definitely take a look at our website, cnyfertility.com. And then at the top on the right, I was just looking to see if I could find it quickly for you. It is under resources and injection lessons. So cnyfertility.com, all the way on the right, click on resources, and then scroll down to injection lessons. And there is a video there on exactly where to place the progesterone and oil. It is an intramuscular injection. So, and it oftentimes is we can get over the hump of, if we're scared of shots, can kind of get over the hump of the belly shots or the subcutaneous injections, but something about those progesterone injections in the muscle feels really scary. But I assure you, having done 70 of them to myself, they are something that you can get through. Placement is a big deal. And then just proper pain management can be a big thing. So if it's the pain of the shot itself that's really affecting you, ice was my was really my best friend. Oh, you will be able to do it, Nefertiti, I promise. Even though I'm obviously a nurse, I didn't think that I could kind of get it in the right spot either. And certainly I did. I was able. So you will too. But if not, maybe you can get a friend or your partner to help. If for some reason it's just you can't get to it. But I assure you, many patients of mine over the years have said that there's no possible way that they could inject themselves with progesterone, and yet they were able to make it work. So you can definitely do it too. We'll take one more question or so before we wrap up. I would love to see comments, and I'll come back and take a look later, but give me ideas of the things that you guys want to talk about. I certainly don't want to come to you every Monday night or every other Monday night, whatever the case may be, with something that's not of interest. And it sounds like from some of our commentary that this was indeed a helpful topic, but please let me know the things that you want to know more about. Even if it's just a question, you just want to have one session that's all questions, that's completely fine. But I want to make sure that I'm bringing you valuable information that you can use and that would help. Brandy, I love this, and you would not be the first patient or client to have the same experience. That you actually do better giving the shots yourself. And that's sometimes the case, that the fear of having somebody else do it, kind of not know when it's coming type of thing, can be worse than just doing it yourself. And so play around with it, see what works best. But ultimately, the progesterone shots are absolutely something that you will get through. And as you go, especially as you get that positive pregnancy test, and then you see that beta doubling, and then you see that the baby on the ultrasound for the first time, and then you see heartbeat, and as everything goes, those progesterone injections really do get easier, because each injection is one day closer to that ultimate goal. So maybe do a video of steps from A to Z, doing a retrieval in March. A little confused on the steps. Definitely take a look back at a couple videos ago. I kind of did an A to Z, but as we go, I'll try to do more of those, kind of throwing those things in. But yeah, absolutely. The steps of the process can often can be a little bit intimidating and overwhelming. And so absolutely. Also, Nefertiti and anyone else wondering, if you're a current patient of ours and in your patient portal, you have something called the Global Travel Packet. There's a really nice A to Z kind of how does the IVF process work, what happens on what day, type of thing in that packet. So right here, right now, if you're a current patient of CNY Fertility and you've had your consultation, chances are in your patient portal, you have that travel packet that'll give you a lot more information on the process from A to Z. All right, last question. Kaylin says, it was suggested for me to do the shots in my arm. Is it best to do it? Yeah, so if you're gonna do, the subcutaneous injections, you can give them in the back of your arm. You can really give them anywhere that you've got some subcutaneous tissue. So some people choose to do them in their thigh, like the inside of their thigh where they can pinch up a little bit of skin. Ultimately, if any reason you don't want to do them in your belly, or we've recommended you do them in your arm for some reason, definitely it's the back of the arm that you want to inject that in. Yep, absolutely. And I know I said last question, but for real this time, last question from Liz. Can I become a CNY patient and live out of state? My friend, of course you can. We have a insane percentage of our clients come from out of state. And that's what we are here to do as the global travel team, is to support all of our patients who come from not just out of state, but maybe just out of the area. Maybe they live too far to drive to one of our offices from home. And so we have an entire team of nurses and staff members set up to support our people who are traveling from out of state. So please, yes, give us a call. We can absolutely help you. And as we do so many hundreds of patients that come from all over the country. And we really enjoy what we do. We're here for you. We're here to help support you in your journey. And so I really hope that this video has been helpful. I hope that some people will drop some ideas of different topics that you'd like me to cover. Again, YouTube, I'm sorry, I keep looking at the Facebook friends. But thank you all so much. It's really such a great time taking your questions and learning the things that are important to you, and then kind of branching out from there. So thank you all so much. I hope everybody has a wonderful week. And again, drop your ideas in the comments of topics you'd like to see moving forward. Okay. I hope everybody has a wonderful week, a great night.